thank you, and thank you all for coming to the webinar. And we'll get started. I like to do these, where we go through the presentation, and then we have some time for question and answer. So I'm Michael Gold. I'm a dermatologist in Nashville, Tennessee, and I have spent years looking at acne and have been intimately involved in how do we use technology to further the efforts of our treatments in a digital age. And I've often been quoted as saying that we walk around with our cell phones and our tablets, and we use our laptops like we are tonight and so forth, or desktops. We get information about diseases from computers and our phones and everything else. Why not start thinking about using technology for our acne? And there's reasons why I say that, and hopefully that'll come out a little bit in this webinar tonight. I want to thank Aerolase and the team there for letting me do this. And I'm moving the show, so okay. So this is who I am. So I'm in Nashville, Tennessee, and I always tell people I spend an inordinate amount of time in China, doing a lot of teaching, and in Asia and around the world. I'm very fortunate at what I do, and have been involved with lasers and light sources for well over 20 years. Have many in my office that are used on a regular basis, and quite frankly, the Neo gets turned on in the morning, and for our acne patients, and it doesn't get shut off until I go home. So we like that. And the nice part for my world is that, and we can talk about this later, it's a cash-based business. It's a little bit different in how you price it maybe than you would somebody coming in for full-face facial resurfacing with wrinkles, because we're dealing with younger people for the most part, and we're not curing their acne per se, although we get really long-term and really nice results. So let's talk about, just for a minute, and again, we have a very mixed audience on the phone with us. Acne is a very common disease. There are lots of different reports out there. Some note that about 94% of all people will have acne at some point in their lives, males and females. It's not just for teenagers. If you look at what the medical companies are doing, they're spending an inordinate amount of money talking about the young female or the adult young female, because that is a huge market, and again, a perfect spot for the Neo device that we're going to be talking about tonight. We need to be aware that we have mild, moderate, and severe acne. Most patients come to me after they've been on a lot of other things. I am not usually the first person that somebody's going to come to anymore, although as dermatologists, we like to think that. So if you're a primary care doc out there, family doc, or whatever, you're going to see a lot of acne. And the biggest thing that you have to determine is what kind of acne it is and what are the best treatments out there. And so in the real world, you have medicines and devices. And so you have to make a decision when it's appropriate to use your medicines, when it's appropriate to use your devices. My patients are, as I said, are a little bit different in that a lot of them come in on medicines, and what I try to do is maximize their medical care. And we introduce the devices pretty early in their treatment because, again, medicines take time to work. And so if you look at any of the medical trials for topicals or even systemic, some of them take up to 8 to 12 weeks to be effective. And I always tell my patients want to be better yesterday, so I need to be using my medicines, but I also need to be using devices which work really fast, within a couple days. So, we're at a really nice benefit for our patients when we can get them better faster. So, again, I spend a lot of time with acne patients, getting them on medicines and getting them knowledge about what our devices can do, what Neo can do, and so forth. So we have lots of treatment options, and as it says here, medical therapy is the gold standard for acne. And again, there are different regimens out there, and there's different guidelines. The American Academy of Dermatology has wonderful guidelines on how they treat and how they recommend we start with retinoids and then add antibiotics and topical agents, and whether you need systemic things later. We have, and I don't do that always. I sort of look at the patient and judge what they need, and most of my patients have a big inflammatory component. I want them on something anti-inflammatory pretty quickly. So we have topical and systemic antibiotics. We have topical benzoyl peroxides, which are now over-the-counter, every one of them, salicylic acids, various sulfa derivatives. We do have some new combination medicines. Combination medicines with benzoyl peroxide and clindamycin are very important in our world, and we use them. We have some newer ones that are a little more powerful than some of the older ones. Again, most of them are being marketed not only to the teenagers, but to the young adult female, because that's a very big target. We actually also have topical dapsone gel, which is a very popular topical dermatologic agent, and we use that a lot in our patients. It has wonderful anti-inflammatory effects. And again, we have retinoids, topically and systemic, with isotretinoin or Accutane, which doesn't exist anymore, but we have generics of Accutane that we still use when we're needed. And I always tell my patients, if you're thinking about Accutane, give me 30 days, which is what the wait period is if you're a female and you need to get on birth control with the iPledge system. And for the most part, I can have most of your acne cleared. So I don't have a ton of patients on Accutane anymore, but I do reserve it for when I need to use it. There are a couple different things that you have to remember about acne that are problematic. And this is across the board. None of this is new. As I said, topical therapies take a long time. Systemic antibiotics, even the minocyclines and doxycyclines that we use the most, have bacterial resistance issues. So we are more prone to not want to keep patients on them for long periods of time, or patients don't want to keep themselves on it for a long period of time. There is a report back in 2004 that if you use systemic antibiotics like minocycline for long periods of time, you can get an increased risk of breast cancer. I'm not sure that's ever been substantiated, but it's there and it's in the literature. And there is a report in the Archives of Dermatology in 2005 that says systemic antibiotics increase the risk of just generalized infections when we have them on chronic minocycline and doxycycline. And then I have a question mark, the effect of the iPledge system. Well, we know it works, and if you don't know the iPledge system, I could spend 2 hours talking about it, so I'm not. But iPledge is basically a government program where if you want to give somebody Accutane, you, the pharmacy, and the patient must get on the computer, do a bunch of work, and everything's got to match up so that they get their medicines. And it's a monitoring system, so we make sure the patients only get what they're supposed to get, only for the amount of time they're supposed to get it. There are no refills when we do that. And it's a check and balance because, again, we don't want females getting pregnant. We don't want people jumping off bridges. So it's a way we have to see our patients, make sure we monitor them, and so forth. But, again, that's a concern. So when we talk about lasers and lights, we have three main premises or three main ways that we treat acne. We actually go after the P. acnes itself. You can do that with a variety of different lasers and light sources, so whether you're using blue light, IPLs, the Neo, vascular lasers in general, all of these work by destroying the P. acnes bacteria. It's almost, I call it almost like a PDT type of reaction without using a photosensitizer. You can destroy the entire sebaceous gland and the sebaceous output. There are devices in the near-infrared range, one in particular that was very popular about 10 years ago. Most patients couldn't stand the pain that was associated with it, so it's rarely used anymore, that particular device, but others exist, and on occasion we do that. And then there's what we call partial destruction of the sebaceous gland and destruction of P. acnes, and that's through the use of photodynamic therapy. And it's with some newer compounds that you'll hear about over the next 5 years that are being developed that are nanoparticle deliveries using light sources that do the same kind of thing. So we're still, we're in a really nice spot because we have some great things that work now. And we're going to be looking at other things in the future to see how we can make things even better. So, again, this is old. This is almost 10 years. I've been writing about devices for acne for years. Again, I'm a big proponent of technology, and this is one that we wrote. Others, Gilly Munavali, Bob Weiss, again, experts in lasers, expert dermatologists have written about their experiences. And in Europe, this is from the British Journal of Dermatology. In Europe, we're seeing a major increase in the use of devices with the right patients and right kind of hands, just because, again, they work so well. So we have selective photothermolysis of blood vessels. Again, we know that some of our vascular lasers and the IPLs and so forth target blood vessels. We can reduce the inflammation around it, but again, as I said, we're really destroying P. acnes, which is this phototoxic or bactericidal effect that we have on the P. acne bacteria. And with depeding, we're obviously doing something to the sebaceous gland with these devices. And you put all three of them together, again, this is what NEO does, this is what others do. It gives us a wonderful way to go and treat our patients with acne. So again, we have devices that have been used historically, and again, I've talked about some of them. The vascular lasers are number one. The infrared are for the most part, if they're low, the 1320s don't hurt very much and they're not that effective with acne, and the 1540s or 1450s, they penetrated really well, but they hurt a lot, we don't use a lot of them anymore for acne. And the long pulse 1064, even though its peak absorption is hemoglobin, and that's good for us, it really doesn't help tons when we're treating our acne patients. So NEO is short pulse 1064, 650 microsecond 1064 laser for acne. And it's painless. And the best part of this machine, which we don't even talk about anymore, and I should have put it up there and I didn't, it's a device that fits, that is basically in a suitcase that you can put in the overhead compartment of an airplane. So it's portable. It's very portable. And when you treat patients, it doesn't hurt. So it's a painless device. It's a portable device. And so if you're not fortunate to be in a 20,000 square foot office with 50 exam rooms, and you're in a city or in an office that has 3 or 4 exam rooms, and you want to cram 10 devices in there, it's hard. This is basically, as I said, it's the size of an overhead suitcase, what you put in the luggage compartment of the airplane, and there's no space concerns for this. So it's one of those devices that meet so many of the criteria that we want, safety, efficacy, convenience, and doesn't take up room. And that's a big deal. And so you need to be thinking like that or thinking of that, because that's really important. So again, when you do these three things, you can get, with the shorter pulse, gentle pulsing, stacking of pulses that allow us to get in there and treat these patients that have moderate to severe acne. So there was a clinical study that was presented at the ASLMS last year by Khalil Khatri, again, a great group, and Natalia Garaskova, where they looked at 100 patients with moderate to severe acne, all ages that were less than 25, and again, these patients were on no topicals. You see the laser settings that were used here, no complications, no hyperpigmentation, no burns, no scars, or increase in acne. And again, when you think about this or you know anything about acne, sometimes when you give medicines, they flare. So we don't want them to flare, and that's good. And there was a high patient satisfaction, particularly due to the rapid and aesthetically pleasing results. So patients got better in this study. And again, I use this on my teenage population, and again, I used it on my adult population because patients want to get better. And again, they want to get better faster, and this is our ticket to getting patients better. So you clean and dry the treatment site, you preheat the facial vasculature and sebaceous glands with lower fluences, which are usually 2 to 3 passes across the site, anywhere from 14 to 28 joules per centimeter squared. You apply higher fluences directly on each lesion, and you do as many pulses as you really want. Again, it doesn't hurt. The lesions will become pale, and you'll actually see some shrinkage in some of them almost immediately, and that's wonderful for the patients to see. You're not going to make every lesion disappear the first time you treat them, but you do see some improvement, and again, patients like seeing that, and so that's very helpful. As I said, it doesn't hurt, so you can go over and over it until you get your desired results. So I want to show you what this does. I mean, I could talk about it all day, but until you see it and do it, it's hard. So this is not my patient, but this is Natalia's patient from that clinical study. Again, you're looking at somebody with moderate to severe treatments, moderate to severe inflammatory acne, and look at her before and after. It's 3 treatments. And I do these every 2 weeks. You can do it every month. You can do it every whatever. My preference is every 2 to 3 weeks. And if I can take her before and tell her in 6 weeks this is what she's going to look like, this is wonderful. Now, the Neo is not going to treat scars. I mean, it'll improve some of the scarring. All these devices smooth out the skin somewhat, but this is not going to be my #1 go-to for scarring. But with her, and again, this was part of the study, so this was without any medicines, that's pretty darn good treatment that you get from that. Because it's a 1064, it doesn't care about color of your skin. So here's a patient, again, before and after 3 treatments, African-American, dark skin, and you see the kind of results you get. You don't get post-inflammatory hyperpigmentation. Again, really, really happy patients that you can treat this way. Another patient here, again, darker skinned individual, really bad inflammatory acne, and again, after 3 treatments, you can see the marked improvement you get. And another patient here, and this is a very common acne presentation where lots in the temples, and patients sometimes don't want to put medicine by their hair or things like that. This is a great opportunity for the light sources like Neo to work here. Again, this is one of the things we found out really quickly when we started using devices. Even though we always think they're best for inflammatory acne, we know from many clinical studies that have been done on all these devices that we're not only getting the inflammatory component, but we're making the non-inflammatory acne better as well. So you see in this individual with all these comedones around the mouth, again, 3 treatments later, it's gone. So here are some of my patients. And again, the reality is you have to understand some of the stories, and I'll get to some of the stories of some of these people. But you can see some really bad inflammatory acne here with numerous cysts and so forth. So you need to be aggressive, with medicines. In this case, the patient was on some oral and topical medicines, but not getting better. And then 2 treatments with the Neo, you see what we were able to achieve. And again, somebody with a really bad inflammatory acne on the forehead, darker skin patient, this is better. So here's the sort of the patient that changed my view of all this. And again, you have to understand the story. This patient, who I've known for years and treated her when she was a teenager with 3 courses of isotretinoin, and it didn't work. Every time she got on the drug, she did well. Every time she got off the drug, she flared. And she had a mobile living thing where she had to go away at times, and so I would see her every so often, and she came back a few years ago and said, help me again, and I don't want to take isotretinoin. So I want you to sit there and go, okay, she comes to you looking like this on the left, and she does not want to take isotretinoin. And so if you're thinking, okay, she's got these huge cysts, the first thing I'm going to do is excise these cysts, that's wrong. You don't want to do anything that's going to cause more scarring. So you've got to think about how you would approach her. And again, we did use some systemic and topical medicines, but you see she's 6 treatments, she's post 13 months now, and she's all clear. And here is the side view of the same patient. And this is where this is why you go to work every day. This is what makes it worthwhile. This is why I do what I do, and my staff, most of which is listening, this is what we do all day, and this is what makes it worthwhile. So you can use, some intralesional steroids if you need to, and you can use some medicine, but that's not going to take care of this problem. And again, this is what NEO did, and this is what NEO does. And so, again, in combination with your medicines, which take a long time to work, the NEO works quickly, and this is 3 months of treatment every 2 weeks for six treatments, and she's a year out. And again, I put her against anything that I do for acne for efficacy and what you can get out of this kind of treatment. So if you have any questions on acne, submit them, and I'm not sure how you're submitting them, but I would assume that you're going to type them. I'm asking the host how you want to handle questions. So, I'm not done, so I'm going to keep talking. But if you have questions, you can start submitting them now at the question and answer on your screen. But I don't want to stop here because this is an interesting device. So, it's a 1064 laser. Even its short pulse and its target is mainly hemoglobin, it works for a lot of things. And so the versatility of this is also something that you need to consider. As I said, I'm in a different environment than most everybody on this call. I got 40-some-odd devices. I'll use a lot of different things because I have it available. But when you're picking and choosing what you want to use in your clinic, you've got to say, okay, well, I treat a lot of acne, and this may be a good thing, but, acne is not everything I see all day. What else can I use it for? And so, here are some cases of hair reduction. Again, it's 1064, so it doesn't care what color you are. And we know that 1064 long pulse is the safest for hair removal. Well, 1064 short pulse is the same. It's safe, and it's safe on dark skin. So all of these patients work really well. So here's a case of mine. And this is a very common thing we see. This is the pseudofolliculitis Barbie, which is related to hair, but you got to treat as almost like a hair reduction device when you're treating with lasers and light sources to make these papular lesions go away. And if you biopsy this papular lesion on the left, it's really a scar. So this is where the hair is growing up. It's twisting around, it's nicking the skin, and we get what lay people call hair bumps. And we see them on the face, and we see them a ton on the back of the neck and the back of the scalp. But again, this device works incredibly well, and this is the same guy. So here he is, four treatments, 4 months post 4 treatments, and here he is 18 months, post 4 treatments. So again, once we get there, this is lasting, which is wonderful for our patients. Another patient, again, very common that you see, this is a patient, again, dark skin, who tweezes because those hairs are bothering the heck out of her. And this is just with 1 treatment. You can see the marked improvement. Now, we're not done yet, but we'll keep getting, and in a couple more treatments, this will be clear. So again, you can use it for a lot of different things. This is for skin tightening. Again, 1064 is one of those wavelengths that early on was actually compared to thermage for skin tightening, radiofrequency. There was a guy named Mark Taylor who did this incredible study looking at 1064 wavelengths for skin tightening, and we were able to show skin tightening. And so you can do the same thing with this device if that's what you choose to do. And again, it's a vascular laser. So we know it's going to work on blood vessels. So here's some facial veins. This is one treatment, zap, bye. And you actually can look at the one on the left. They're almost like depressed vascular lesions for some reason, but they're gone they're gone at this point. So we get this all the time. So here's a patient of mine who had a filler injection given, and I'm not even sure if it was at my office or not. I would hope it's not, but probably was, and bruised a couple days after the filler. We know that vascular lasers work really well on post-filler bruising, and this is just a couple days after one treatment. We can make those bruises get better. So again, very versatile device. The redness from rosacea, vascular lasers should be part of everybody's talking when you're talking about how you treat rosacea. Again, we have some really neat new topical medicines, some of which work really well, some of which work a little bit well, but patients don't want to be on antibiotics forever and a day. So rosacea is a vascular phenomenon disease, and if you can treat the vasculature, why not make it go away quicker? And so, again, this works exceptionally well. I see something called poikiloderma a lot. Poikiloderma is this weird redness, crepiness that people get on their face, on their necks and chests, and we can make that go away really quickly. It's really common in females, but I also see it in males. This is a male, and again, we can make this go away without much difficulty in our patients. And again, these are really happy patients because this is painless. And I keep stressing the fact that Neo is painless, and that's important. And if you look at this one in the bottom lip, right in the middle, there's a little blood vessel there. Again, one zap and it's gone, and so forth. But what about pigment? So 1064 short pulse 1064 actually helps pigment too. So we got a laser that makes acne get better, vascular get better, pigment get better, removes hair. And again, it's portable. This is unbelievably useful for our patients and for things that you can do for you. So this is patient comfort. I love the fact that it has no consumables. The market in lasers, it's an interesting thing. The consumable parts of the laser business has become very popular because the companies sell a device and, that's it. If they sell a device and they sell a consumable, they get the best of both worlds. This doesn't have a consumable. That's great for us. So I don't like things that have consumables, but in reality, that's becoming the norm. For this one, there's no service contract required. The new technology platform eliminates optical fibers. There's no water circular system. And again, it's portable, which is really used. If the device does not work for some reason, and the guys can correct me if I'm wrong, you just ship it back overnight, and they ship you one while they're fixing yours. It's really painless and it's really seamless when you do that. So that's really helpful. And I think that's my last slide. So I'm happy to open it up for questions. I do want to talk about pricing for a minute because I think it's really important. So, and pricing is varied based on location in where you are. So if you're in the United States, it's going to be different than if you're in China or in India. But if you're in the United States, the pricing is going to be different if you're in New York or Los Angeles versus maybe Nashville, Tennessee. That also is a reality of life, and it's not going to change anytime soon, so you've just got to get used to that concept. But with acne, so if I'm doing a procedure and, you know, if I'm doing a whatever procedure and I'm charging, you know, $400 or $500 for that treatment, I can't do that for acne. I just mentally, morally, or whatever, I can't charge my teenagers whose parents are usually paying the bill that kind of money. So our fees for this range from about $150 to $200, and that's it. When we're doing the cosmetic procedures like poikiloderma or we're doing vascular lesions or whatever, I charge whatever I normally charge for that. But for acne, I'll stress to you to keep the prices in the what I call the reasonable range, just because it's cash and they're young, and it's disposable income that many of them don't have. And I look at it, you know, if you do enough on volume, this is a no-brainer. So again, that's something you all have to figure out. I will tell you, this is not codable. You cannot charge this as a destruction. I don't care who tells you what in your billing offices or your consultants or companies out there that I've heard have done this. I know of several physicians around the country that have had to pay back hundreds and hundreds of thousands of dollars because they charged this as a destruction code, not with Neo, but with another device. And when they got audited and realized it was a laser procedure, you know, when you mention laser, you know, 99.9% it's cosmetic. And so this is cosmetic. So keep it that way, but keep it reasonable. So with that, let's open it up for questions, if you have any questions, and we'll go from there. So thank you for all listening.
So Sean, there are a few questions here that I'll go over first, okay?
Excellent.
So somebody wrote down, these are really small on my computer tonight, are there any journal publications on the Neo? And the answer is yes, there are several, and I'm sure the Aerolase team can get you. Dr. Khatri and his group wrote something, I think it was 2014 in the Journal of Cosmetic and Laser Therapy, and it was published. And David Goldberg and his group a year later published something in Derm Surgery. We're actually trying to put together a very large acne monograph now that's in the works, so we can get the word out to people on what we do with that. There are some things out there. My experience right now is just all my experience, just using it time and time again. It was, again, the second part of that, the first question was about payment, patient charge, and is it covered by third party? Again, I never charge this to a third party carrier. As I said earlier, I've been called to be expert witnesses in several lawsuits involving people that use destruction codes for light sources, and the billing procedures were, when they added them up, were in the hundreds and hundreds of thousands of dollars. And in every instance I've been involved with, the insurance companies or the doctor that was being audited ended up having to pay back everything. So I look at this as, as I said before, we treat this as a cosmetic part of our acne treatment, and I keep the prices reasonable for a reason. Are we curing acne? I don't know. I don't think so. If you listen to Rox Anderson, the only time you really cure acne is if you bombard it with red light and, massive amounts of PDT to the, where you put the patient in bed for a week. I don't do that. But if you look at the girl that I showed, it's been clear for a year and a half. She's now 3 or 4 years clear. Did I cure her? Probably, but I can't tell you that I did. So, just be careful. Again, I keep the prices reasonable. I've done this long enough. I do, anywhere from, I tell people 8 to 10 treatments a day, and you charge $150 to $200 5 days a week. You do the math. we're doing okay with it. I'm comfortable. I have people that are very skilled laser people doing this in my office, and, you know, it works. So that's that. So acne, the average number of treatments. Well, so I don't have an average number of treatments. I think it's on how the patients are doing. I like to tell my patients that my ideal things here are to treat every I like to treat every 2 weeks. I'm a little more aggressive with acne maybe than others, but I like to treat every 2 weeks. On average, I tell them it takes 2 to 4 visits, and then I tell them average means average. So you may get better in 1 or 2 visits, and I still may be treating you 5, 6, 7, 8 times. I don't know. Everybody's acne is a little different. You know, some patients don't want medicines. If I'm using medicines, I think I can get them better faster. But again, everybody's a little different. Somebody said, heard 6 for last cystic acne patient. Again, that's what it required for that patient. She had really bad skin. You know, again, I don't really care just so the patient's getting better, and that's how I sort of judge how many treatments. Again, out-of-pocket is what this is all about. Somebody said, what is the chromophore for NEO? Well, NEO is a vascular laser, so the chromophore is blood, but it's also, you know, it's a 650 micron 1064 laser, and we know the acne pathways are a little different. So we're also probably in the process of destroying the P. acnes itself, is sort of what we're looking for here. And in that process, we're targeting coproporphyrin 3, which has a wavelength spectrum of about 630 nanometers. So we know we're affecting that, but it's probably more the blood supply and how we do it, and I don't think that's ever been worked out. So again, the next question, 150 to 200 for is that per treatment or total treatment? No, that's per treatment. So again, it's $150 to $200 per treatment. What is the downtime, typical healing process? There is no downtime. Patients can get a little bit pink for an hour, but it doesn't hurt. And, you know, again, the more aggressive you are, they may get a little red, but again, I'm treating tons of teenagers and young adults who have to go to school or have to go to work. So this is not a procedure that they can afford even a day off. And so most of my patients come in, get treated, go right about their business. And that's what I like. So again, I don't have any problems post-treatment. Can you use this device for PDT? So I don't use this device for PDT because again, you can. This is 1064, and the devices that we use for PDT, you know, are red light, blue light, IPL, vascular or pulse dye lasers, KTP lasers. Those are the most common devices that work within the range when I'm actually doing PDT. When, if you don't know what PDT, it's the application of a photosensitizer. We use something called Levulan in the U.S. And then use a light source. The Levulan is not going to be activated very well by the 1064 device, so I don't use that for when I'm doing PDT. All right, so I'm going down my list here. The price point for acne, which you mentioned, is that per session? Yes. What is the approximate cost? We've gone over that a bunch. What is the word on using cosmetic laser on cancer patients, on chemotherapy, and on remission? Any concerns? I have no concerns, just so the patients got clearance from their, you know, again, depending on what kind of cancer. I'm not causing cancer with any of my lasers, and if the patient has a concern, even if it's a resurfacing or a radiofrequency or anything, I'm happy to call the oncologist or their primary physician, but I have no concerns. I want to offer free treatment to my patients undergoing chemotherapy or cancer survivors. I think that's a wonderful idea. Again, anything you can do to help a cancer patient. And I think it's important. There's a lot of times in my practice where I'm like working really hard during the day and I have a patient and I really know they can't afford a NEO treatment, and it only takes like 10 or 15 minutes of my staff's time. And so I'll say, just give them a NEO treatment and, you know, get them interested in what I do. Because if it works and they see an improvement, a lot of times they'll come back and they'll find the money. But again, I'm not opposed to giving free treatments either. I mean, it's what we give a lot of free treatments in dermatology. How long? Again, each treatment is about 15 or 20 minutes. Post-care is really nothing. I mean, so again, my patients undergo, or my typical patient is on a medical, in the real world, a medical routine in this. So there's two ways to approach how you do this. I have patients that come to me because they want a laser treatment. They've been to 14 other people. They're sick and tired of what they're doing, but they still get they still get medicines on day one. Again, we're fortunate in dermatology. We still have enough different things that I can offer, and we'll try to customize the treatment to fit their kind of lesions, and we'll start treating immediately with the Neo. If somebody is a new patient in my clinic and it's something that I'm thinking about offering them or bringing into the mix, which is most of my patients, I'll actually get them started on medicine, and I will actually bring my consultant laser people over to do a consult and at least introduce them to the Neo, because that's important. Because sometimes they're not ready, but sometimes they are. So, we sort of introduce the Neo to them, and again, if they can choose to start it immediately, a lot of people, or not a lot, but some of my patients will, when they come back for a visit, then they'll start doing what we ask them to do. Do you delay or modify if the patient is on a photosensitizing drug such as doxycycline? Absolutely not, because it works in a different wavelength than any of the antibiotics do. So the antibiotics don't affect any of these light sources. I have no problem them being on doxycycline. What can we do to justify use with insurance companies given the increased and very high cost of drugs? Clindamycin, topical retinoids, what can we do? Well, again, I think we are all in a dilemma today because our drugs are so ridiculously expensive. In dermatology, we do have some specialty pharmacies if you're on a non-government funded insurance program, and I utilize these programs all over the country for my branded drugs that I can get for my patients from anywhere from $0 to $35 if I can get it, because our drugs are too expensive. I mean, again, you said, topical clindamycin can be ridiculous, and so the generics have gotten out of hand. I mean, clobetasol, which is, is a very powerful steroid, used to cost my patients $10, and now it's $200. And so, my patients can't afford that. And the reality of the world is, the patients that can't afford it can't afford it. The patients that can afford it won't pay it. So, they don't, so we're sort of left in a quandary. So if you have an opportunity to use specialty pharmacies that, if they work for you, then, then you can do that. Can they use topicals? I start topicals that day. If they're using it, they continue. How well does it work for acne scars? So here's the deal. I think that any light source that we put on the skin will help acne scars somewhat. This is not what I use for acne scars. So what I will do is I'll get them clear for this, see how they do, and then I'll introduce another modality, whether it's a fractional laser. And we have erbium devices from Aerolase, again, portable erbiums that work really good for acne scars. Or you have radiofrequency needling or whatever. There's a lot of different things you can do for that. Do you use retinoids before, with, or after? I never stop my retinoids with this. I just keep treating. Nissan, thank you, Michael. Thank you, Nissan, for being on there. Appreciate it. Do you use the same pulse width for types 1 to 6? Yes. The settings are usually just always the same. There is a cheat sheet. I'm sure we can get it all for you. I have no problem using Retin-A with this. What specialty pharmacies do dermatologists use for the recently overinflated prices that I just mentioned? Again, there's a lot of specialty pharmacies out there. Minus Philidor, which we don't use anymore. But I mean, if you're using Valiant drugs now, we go to Walgreens, and they do a fine job. I use pharmacies called Wyandotte, which is in Michigan. There's Direct Success in New Jersey. There's Ermat in New York. There's a ton of these places out there that, you know, work with you and work with your patients to get what you need when you need to get them. You know, and hopefully everything is legal and straightforward. Will you just add a couple more if time? Any special considerations for darker skin? No, there's no real consideration for darker skin. 1064 is the darker skin choice. Okay, you know, we use 1064, and I think you know, looking back over time, people like Elliot Battle, who's up in Washington D.C. in the Bethesda area, you know, have spent their careers teaching us that 1064 can treat dark skin types safely and effectively. And so, you know, don't be afraid if somebody's dark, you know, again, types 4, 5, and 6, to use this on their acne. I do it every day, and I think that it's a wonderful thing for that. How long do you tell your patients the effects of meal will last? Well, I don't know. Again, nobody's ever looked at the long-term effects. I will tell you, I've had patients that, you know, will come to me every 6 months because they feel a few pimples coming up and they want another treatment. And yet I've had people that have stayed clear, as I know, for 3 or 4 years, and that's good. And again, that's about the length that we've been using it. Probably I've been using it for close to 4 or 5 years now. So we have some pretty good long-term follow-up, but I don't know if anybody's ever put anything together for that. The cost of the machine, I have no idea. I'll let them tell you all about it. Yeah, these machines typically list, I mean, again, this is total guess on my part. These machines probably list in the $80,000 range, as you know, that's the starting rate for most every device. And you can talk to your reps and salespeople and see what you can do with that. Do you require any skin care after the laser treatments? Again, I don't think you need anything special because, again, my patients are using medicines. So I don't really do anything post any of that. So that's what I do. All right, Sean, I think we got all the questions.
No, I think that's great.
You know, I tell people this machine goes all day, and if it goes all day, then I'm a really happy person. You don't want a device that ends up being in a corner and it gets turned on once a month and you do it twice and you're done with it. That's what I want to, you know, that's why I want my devices to, that's where I'm the happiest. Thanks. There's 2 more questions. Are the settings used for hair removal much different? They're not much different than acne settings. Again, we can get you all that. And Jane Glaze, thank you for your talk. Thank you, Jane, for listening. So again, you know, this is, if you take care of acne, as I said at the beginning of the presentation, we all are sitting here with technology. So you're on your computer. Half of you were on your phones while I was doing this. I was texting my son a little bit, who was one of the calls in the back. Hey, I'm on a webinar. I mean, we use technology every day. So why not incorporate it into what you do for your patients? They're going to love you for it. So that's what we do. So thank you all very much. I really appreciate it.